The Texas Medical Association is a dynamic organization of nearly 53,000 physicians and medical students who drive the association's activities. To foster grassroots action at the local level, members also belong to one of 110 county medical societies throughout the state. So who runs TMA? You do! In the next 20 minutes, you will learn much of what you need to know to get started serving in leadership in TMA, America's largest state medical society. Viewing this entire program entitles physicians to earn continuing medical education credits in ethics. The Texas Medical Association is accredited by the Accreditation Council for Continuing Medical Education to provide continuing medical education for physicians. The Texas Medical Association designates this enduring material for a maximum of 1 AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participation in the activity. Policies and standards of the Texas Medical Association, the Accreditation Council for Continuing Medical Education, and the American Medical Association require that speakers and planners for continuing medical education activities disclose any relevant financial relationships they may have with an entity producing, marketing, reselling, or distributing healthcare goods or services consumed by or used on patients whose products, devices, or services may be discussed in the content of the CME activity. The content of this material does not relate to any product of a commercial interest. Therefore, there are no relevant financial relationships to disclose. Here's an outline of what we will cover. Who runs TMA? You do, our history. TMA leadership. Council and committee charges. Effective councils and committees. TMA policy, education, and activities. We'll see you at the House. Addressing House assignments. You have help, and a final message. It all started back in 1853 when 35 pioneer physicians rode to Austin by horseback, stagecoach, and railroad to organize the Texas Medical Association. After several years of meeting in various towns around the state, by 1900 the association was ready to put down roots. In 1903, physicians established TMA's first headquarters in Fort Worth. By 1950, TMA relocated to Austin, and in 1991, the association moved to its current home near downtown, the Capitol, and other state office buildings. Today, TMA is a grassroots organization of more than 51,000 members, working closely with more than 100 county medical societies across Texas. TMA's governing body, the House of Delegates, is composed of approximately 500 voting members, including elected county medical society delegates, 1 delegate per 100 members, and ex officio members, the Board of Trustees, 15 counselors, Texas delegates and alternate delegates to the American Medical Association, members of the Council on Legislation and chairs of all other councils, delegates of selected specialty societies, and delegates from the Young Physician Section, International Medical Graduate Section, Resident and Fellow Section, and Medical Student Section. The House of Delegates adopts TMA policy and oversees activities to carry out TMA's purpose, mission, and goals. In addition to implementing TMA policy, the House of Delegates receives reports from TMA's councils and committees. TMA's councils may call on committees to help them carry out their work. There typically are 9 to 15 members on a council. Standing committees include 9 to 12 members. Each member of a council or committee serves up to 2 3-year terms. The House meets every year during TMA's TexMed conference. Stay tuned for more information on the House of Delegates annual session later in this video. Council and committee chairs and members are TMA leaders. The TMA president selects them for their experience, passion, and commitment to organized medicine and the health of all Texans.
When all those voices are heard and those voices have a spirit of cooperation and coming up with good policy that's integrated in such a way that it moves forward and it makes our people better. That's what I'm looking for.
Being a member of a council or committee is a unique opportunity to serve as a voice of the more than 51,000 physician members and 25 million patients in Texas.
So if you don't know what to do, they will help you.
And these leaders are in a great position to serve the next generation of physicians by becoming mentors to TMA's resident, fellow, and student members. You also can help spread the message to non-TMA members about the importance of joining TMA and supporting organized medicine in Texas.
You get to bring your values, the values of your area, the values of your community, your own vulnerable patient population. They get a voice. So having that leadership gives me the fulfillment of doing what I trained to do, being a physician, but also maybe affecting or mentoring or creating policy that will help more than just the patients I see at the bedside or in the office, but have a more far-reaching effect for patient care.
And that's what I think TMA is working on, is uniting us together as a physician body to represent all of us.
You always have a place at the table. And I think by being a leader, you're the voice that projects out to those ears that are around the table. And whether or not you're in a public setting, a political setting, or even with your medical staff, I think that's what it takes to be a physician leader.
Each council and committee serves a dedicated purpose. Their charges are contained within the TMA bylaws and describe the reason for the council or committee's existence as well as its function. Parent councils will evaluate the activities of the committees to verify that they are still meeting their charges. Committees undergo a sunset review process every 3 years. Councils can also use their own charge as an internal check to ensure their activities remain relevant. Council and committee members receive a copy of their charges to help guide their work. Councils and committees routinely meet 2 or 3 times per year during TMA's fall and winter conferences and at TexMed. However, chairs may call meetings at any time. Meeting attendance is important, and it is monitored in accordance with TMA bylaws. Members may also use conference calls and emails to facilitate action between meetings. Each council and committee works with TMA staff to achieve their charge. Typically, staff work with the council or committee chair to develop an agenda of items for the group to discuss and take action on at each meeting. Effective councils and committees review current TMA policy within their subject area, identify critical issues, develop policy and recommendations, produce educational programs, contribute to TMA's communication and outreach, and provide legislative testimony and feedback on public policy.
It's an honor to be on one of these councils. You are picked for your expertise or your area of expertise, and that's an honor in itself, but it also brings along a responsibility, because it's not just something you can check that box that you just go and attend. The responsibility of helping to guide the Texas Medical Association and hence guiding your own career.
There is a void, there is a need for physicians to step up and take some of the responsibility and deliver on what we are asked to deliver on.
Just get involved. Come to meetings, see what's going on, listen to what's happening. And then as you hear things that you think, oh, I can contribute to that, I can make that better, I can do something here, then go do it.
All those in favor?
TMA meetings are conducted using the Standard Code of Parliamentary Procedure. The purpose of parliamentary procedure is to facilitate the orderly transaction of business and to promote cooperation and harmony.
It provides us structure, it provides us efficiency in running the House of Delegates and running our various committees and councils. I think it works quite well, and for many of the physician leaders who joined the TMA, they tended to have had prior exposure to parliamentary procedure or utilization of AIP, and it dovetails with AMA.
I think that the chair always has to remember that they are a steward of not only the organization's resources, but of the physician volunteer's time, and that both have to be respected.
It really assists us in being able to take the important aspects and topics that we want to discuss and work on and doing it in an efficient manner.
The legislature has, for years and years,
The things TMA says and does for its members and Texas patients regarding policy, education, and program activities are developed directly from ideas and changes recommended by councils, committees, individual TMA members, local county medical societies, specialty societies, and sections.
The council and committee process, along with the House of Delegates, is a very important, if kind of a leavening process for policy. But the beauty of it is that one student, one physician can have an idea.
Any council or any committee in TMA is we are throwing that stone in one spot, which is going to create the ripple, and it does have a potential of reaching to that point where you are talking about, going through reference committees and becoming a TMA policy and becoming a law. And I absolutely see that it is possible.
Every step of that process in the committees, in councils, in the House of Delegates makes your idea better. And the more it gets fleshed out, the more successful it's likely to be.
Whatever policy the TMA adopts and then implements, which can have some significant impacts for the health of Texans, you want to ensure that it's been vetted appropriately. You want to ensure that the pros and cons have been explored. You want to ensure that members feel as though they had a voice at the table to ensure that we've really thought through this as carefully as possible.
It truly impacts the legislature, it impacts public health agendas, there are educational opportunities, CME opportunities, practice development opportunities that all come from the policy that's voted on in the House of Delegates. And that policy, of course, was created, much of it within the committees, within the councils, and then, of course, from county medical societies as well.
Everything we do has a broad sweeping effect on what happens in the state of Texas.
The annual session of the House of Delegates is an opportunity for all councils and committees to see reports discussed and debated and acted upon. To address the extensive and complex list of agenda items, each annual session, the House of Delegates convenes special temporary committees called reference committees.
And we recommend referral.
These groups consider items referred to them and provide recommendations for action by the full House of Delegates. The 4 reference committees typically established by the House each year are Financial and Organizational Affairs, Medical Education, Science and Public Health, and Socioeconomics.
Microphone 2.
These reference committees divide the work of hearing, investigating, and making recommendations on proposals that have been submitted to the House. All TMA members have the opportunity to testify on proposed action items during the reference committee hearings. A representative of a council or committee that introduced an action item also will typically testify on that item.
Speaking as chair of the Committee on Medical, Home, and Primary Care in support of this resolution.
That's your real key sort of nexus for making policy, is to have RefCons that can really dive deep, hear testimony, endless testimony, if you will, and then come up with the solutions. And so by the time we sit at the House as delegates, hopefully the business has been directed towards a agreeable policy.
The reference committee will deliberate after the hearing to provide recommendations to the full House of Delegates for consideration the next day. They advise the House about action on each item. Any voting member of the House of Delegates can request additional deliberation on the floor of the House. When that happens, only voting House members participate in the debate. The House of Delegates has 4 actions it can take on an item: adopt, not adopt, refer, or amend. Motions, especially main motions, are the foundation for conducting business. Their purpose is to bring substantive proposals before the House for consideration and action. After the House Speaker states a motion, the House may then deliberate on the item. Following debate, a decision is reached by vote.
Let the process that got you there in the first place work, whether it's councils, committees, reference committees. Make sure that all of that goes the way it's supposed to, and everybody really has their chance to have input.
One voice absolutely can make a difference, but we also have a great process that's organized so that committees and councils really set the stage for good conversation to bring up the issues.
And I think it's incredibly important to make sure that the information is presented to the delegates in a way, in basically bite-sized chunks. If you throw a report at someone that has 12 recommendations that are very complex, it may take a little bit longer, but it might be best to say, okay, gang, we're going to do these one at a time.
After the meeting, the TMA Board of Trustees assigns all adopted or referred action items to a TMA board, council, or committee. The audit trail is TMA's mechanism for tracking all action items adopted or referred by the House. The report lists which TMA board, council, or committee is responsible for an item. In this way, the audit trail lists your council or committee's assignments from the House for the next year. Status updates on the assigned items are reported to the House at the next annual session.
Oftentimes, it's resolutions that are passed at the annual session, at the previous annual session, that then are referred to council and committee for research, for opinion statements, for rectifying disagreements, for example. So I think the importance of the annual session is it's our homework assignment. It's our homework assignment for the next annual session, and you must adhere to that. Yes.
Do your job.
Yes. Our TMA staff will track you down. No, I'm just kidding.
Right, I think you would delete it and then they would come back with...
TMA staff members are here to support you and help you make your council or committee service a success. Each TMA board, council, and committee has dedicated staff members available who understand the goals of your group and can get additional help from internal and external subject matter experts if needed.
We're making the decisions with the aid of...
Call on your staff anytime for assistance with tasks such as identifying TMA's position on an issue, reviewing research or data on a topic, finding relevant current laws or rules, preparing a presentation or legislative testimony for TMA, drafting reports for the House of Delegates, facilitating collaboration between committees and councils, or anything else you need.
You're supported by this amazing staff.
They actually are facilitating meetings, making introductions, introducing you to subject matter experts, helping to make sure that you can develop policy ideas, giving you the tools that you need to then advance the ideas or the recommendations that you develop.
Coordination of meeting, coordination of time, getting your agenda, because as a committee chair, it's not only a lot of times for your committee, but you're giving liaison reports to other committees as well.
It makes it a less daunting task, I would say.
There was never any more of an effort for me than just picking up a phone or shooting a quick email to the staff and just say, this is what we need to proceed on, and it was done.
TMA staff has a passion about helping physicians be successful, and that is great to see that.
And it's not to say that the staff is doing all the work, but it is to say they are absolutely there to support you, to make sure that it's a fine-tuned machine. They carry the institutional memory and institutional knowledge that's incumbent and necessary for us to serve as physician leaders. So you can really come in effectively worry-free, focus on the task at hand, and know that you're going to be backed by an amazing group of individuals.
Make sure that you get to know the staff, make sure that you ask questions, make sure that you're available to them, volunteer for things, and but most of all, be prepared when you come to the meeting, because they've put in a lot of work to get to that point, and they do it for a reason. It's real important stuff.
This is meaningful work with a huge impact. Take this opportunity to bring all your good ideas forward and work through important issues with your colleagues from around the state. Remember, you were selected from more than 50,000 physician and student members to serve as the voice for medicine in Texas. We hope you're ready now to roll up your sleeves and get to work pursuing effective programs and policies that will support Texas physicians and improve the health of all Texans.